The blood supply of stomach. What is a stomach? The stomach is a J-shaped, muscular organ in the upper abdomen. That's a crucial part of the digestive system. It acts as a mixer and reservoir for food, breaking it down with acid and enzymes, before passing it to the small intestine. It is located in the upper abdomen, between the esophagus and the small intestine. Let's discuss a little bit of its structure before starting the main topic. What are the parts of stomach? The stomach has 4 main anatomical regions. These are Cardia. It is the upper part where the esophagus connects. It contains the cardiac sphincter to prevent acid reflux. Fundus. It is a rounded upper section, often filled with gas. It is located below the diaphragm. Body, also known as corpus. It is the large, central area where food is mixed and begins to break down. Pylorus. It is the lower section that funnels food into the small intestine, duodenum. It is controlled by the pyloric sphincter. What are the curvatures of stomach? The stomach has 2 main curvatures that form its characteristic J shape. These are the greater curvature, which is the long, convex, lateral border, and the lesser curvature, which is the shorter, concave border on the medial side. Now let's start the main topic. The blood supply of stomach. The stomach's blood supply comes primarily from the celiac trunk. The celiac trunk is a major artery branching off the abdominal aorta. It supplies oxygenated blood to the foregut structures, including the stomach, liver, spleen, gallbladder, and parts of the small intestine. It arises from the front of the abdominal aorta, just below the diaphragm, around the T12 to L1 vertebral level. Celiac trunk is a short vessel that quickly divides into 3 main branches: the left gastric artery, the splenic artery, and the common hepatic artery. Left gastric artery supplies the lesser curvature of the stomach and lower esophagus. Splenic artery is a winding artery that supplies the spleen, pancreas, and the greater curvature of the stomach. Through its gastroepiploic branches, common hepatic artery travels to the liver, branching further to supply the liver, gallbladder, and the stomach, through its right gastric and gastroepiploic arteries. These branches can be remembered by a common mnemonic. Left-hand side. That means left gastric artery, common hepatic artery, and splenic artery. These branches further branch into more arteries that will anastomose with each other to supply the stomach. Left gastric artery. It doesn't branch further and supplies the upper part of the lesser curvature and cardia. Common hepatic artery. It gives rise to the right gastric artery and the gastroduodenal artery. Gastroduodenal artery gives rise to right gastroomental artery. Splenic artery. It gives rise to the left gastroomental artery and the short gastric arteries. Following are the key arterial anastomoses on main sites of stomach. In the lesser curvature of stomach, the anastomosis consists of left gastric artery from the celiac trunk meets the right gastric artery from common hepatic artery. In the greater curvature of stomach, the anastomosis is made of left gastroepiploic artery from splenic artery meets the right gastroepiploic artery from gastroduodenal artery. Fundus and superior part of stomach consists of short gastric arteries from splenic artery supply the fundus and connect to the other vessels. These anastomoses provide vital collateral blood flow, preventing ischemia of stomach if one artery is compromised.